Hello, everybody. Welcome to another episode. Today, I hounded this woman down because I found this article, and I was like, yes, someone doing something for prolapse, this forward-thinking research. This lovely lady, Shayanti Mukherjee. We've
Hi.
got her on. Welcome.
Thank
Uh,
you.
we've got her on. We're talking about prolapse today and this amazing new research that Shanti's working on, which gives women hope for prolapse. Welcome. Thank you for coming and joining us, Shanti. I know I'd sent you an email that said, I love that I've seen your information in this article. Would you be on a podcast?
No, thank you. Thanks for inviting me. Of course, like I wouldn't miss that opportunity for anything.
Well, when you emailed back very quickly, I was like, yes, this
You
is
know, this is
one episode that I wanted.
yeah, no, it's a great opportunity for us to engage with the community. We don't get much of that opportunity in our job as such, but we do love interacting with people, and so this opportunity was great. Yeah.
Yes. So Shayanti is a professor and specializes in innovative cell-based therapies for pelvic floor disorders and birth trauma injuries, just so everyone is aware of what her background is and why I think you are perfect to be talking about this topic. Um,
Yeah, so we do cell-based therapies, and our goal is to have the next generation solution for women suffering from chronic prolapse. So we do a lot of work in the material science area as well, trying to develop new surgical materials that could be used, understanding how these materials could interact with the body. What can we do to make them more tissue friendly, avoid any side effects, and can we boost them with stem cells, either from women's own bodies in the uterus or any other stem cells, and have the output that we really want? Yeah, so we kind of merge multiple disciplines. We do engineering, we do a bit of nanotechnology, stem cell science, and try to combine that to finances and solutions to problems that are really unfortunate. Yeah.
yes. And I love that you're thinking not only about helping women with prolapse, but also preventing it from happening as well. And the
That's
fact
right. So I think we all know that vaginal birth and childbirth has a major impact and is the main contributor for prolapse that may happen a few years or a few decades later. And so why wait for it to happen? We want to address the problem when it happens. So I think we need to understand how is it getting initiated and what can we do to stop it? Do we need a therapy, or what are the various options to heal the injury much sooner, and prevent it from becoming a chronic problem in the future? So we're coming up with, again, more injectable formats of therapeutics to help repair and reverse that injury.
yes. Um, and going back, I love that you spoke about sort of it is women who have had children, and I from
Yeah.
doing a bit of Googling, it tends to be women. It's saying here with four or more children, they've got higher risk factors, um, and other areas could be the age that they are, their weight. Chronic coughing can cause things like prolapse, chronic constipation,
Yeah,
heavy lifting.
that's
So
right. So most of the research have shown that the first birth is often the problem.
that was mine.
Yes, most of them, and there are multiple studies that have shown that the first delivery is often the culprit. Having
Mm,
said that, and vaginal delivery is the main risk factor for pelvic floor disorders, pelvic organ prolapse. But other factors like subsequent births and, are very prolonged.
Yeah.
Labor, use of forceps, all of these really matter. And then again, it's the constipation, straining, coughing, aging. These add to it as well. So there's yeah, it's quite multifactorial, but definitely the vaginal birth is the main risk factor. Yeah.
Yes. Talking from my own experience, that was the case with
Yeah.
the first one. Um, let's so actually it was funny how I share all this information because I'm quite open with my pelvic floor dysfunction and things like that because I want other mums to think that they're not alone, as do you want to, because we just spoke briefly about it before we
Yeah.
recorded. Um, it seems to be, I didn't realize how big or how common it is for a prolapse because PubMed Central says it's about 40% and
Yeah.
of women experiencing this. But then when I look on National Institute of Health, they talk about up to 50% will
Yeah.
develop pelvic organ prolapse.
Yeah. So look, it is very common. Unfortunately, it's very common. And it is very strange how hidden it remains despite being so common. It's really a lot of women suffer from this, and yet many of us feel we are the only one. We don't have that picture perfect motherhood that we were expecting, or it didn't go like, why are we feeling the way we are? And we
Mm.
feel that everyone else is fine and we are not. Actually, that's not true. It's very common. So, one in four women across all age groups would have some form of pelvic floor dysfunction. The figures about 40% and 50% depends on what age groups you actually calculate. So for women over the age of 50, it could be up to 50%. In some underdeveloped nations, the figures are even worse. And in all honesty, I feel we really don't know the actual figures
Mm.
because it's so underreported. It's tabooed, and I think we are not at a stage where like blood pressure that people will say, oh yeah, my blood pressure is not normal. We don't have that comfort level for prolapse that are self-reporting, or a lot of women also don't know that they have something until like it comes to a stage where they are like, no, we can't. So
Exactly.
yeah,
I'm
it's a so the numbers, there's more research happening, so we would eventually know the numbers, hopefully. But yeah, it's kind of an estimation. There are no hard numbers. That's why it's sort of a little bit here and there, but it's coming. So like a study in Australia, in Sydney metropolitan, clearly said that 2 out of every 3 births, they have some form of trauma. And this was quite life-changing statistics for us as researchers as well, because we thought, oh, some women have birth injury, but actually it can be so common, and not many know about it.
That's crazy. Um, and going back to what you brought up, some women actually are asymptomatic and don't even know that they do have a prolapse. So it's finding those statistics is tricky. And like you said, they don't just sit around like having coffee like others would be like, "Oh, I've got high blood pressure." You won't just sit around saying, "Yeah, I've got a
Yeah.
prolapse, stage 2."
That's right. And uh, it's also like that phase of life is so tough with a newborn. You're
Mm,
struggling with so many different things. And um, one more added thing, it just feels like it's part of like the whole struggle. Like it is a normal part of motherhood. A lot of women have told me that they felt that something was wrong, but they thought that it's part of motherhood, and it took them a lot of time to even realize that this is. But for women who knew about it, and a lot of them even don't have never, many of my friends, or even me before I entered the field, I had no idea about what is pelvic organ prolapse. I had no idea. Many of my friends, when they asked me, "Oh, you got a new job. So what do you work on now?" And I told them, and they were like, "What are you talking about?" And some of them
Wow.
were pregnant, and they just freaked out completely.
Oh,
And many of the young women don't know about it. But now when I see, like, we've been doing this work and talking about it more openly, not shying away from using the we word. A lot of the young girls we see coming to university, they have heard about it. They're like, we know, like my grandma. Even boys, university boys who have worked on our project, some of them have told me, like, yeah, I know, like my grandma really had a tough time.
wow.
So they are, we probably would say that it's getting around. People are starting to talk and hear. I think a lot of times we talk, but nobody wants to hear.
Yes, yeah, exactly.
Yeah.
Let's for list just so for listeners who are aware who are not sure if they
Yeah.
have a prolapse or not, can we go into some symptoms that maybe you might be experiencing if you do have a prolapse?
Yeah. So I think prolapse, the main symptom is like the bulge feeling. It's the dragging sensation of something coming down. Other dysfunction could be unable to, hold your wee or poo. The other sort of symptom could be that you're unable to really have do a poo. You feel like it, but you can't. So sometimes many women have to just use a finger to adjust uh, the prolapse that's coming in, go from the vagina to move the rectal tissue so the poo can come out. So it's the obstruction. So it's a dysfunction. It's not like just you can't control, but it's also like getting obstructed. Um, yeah. So there's when you have the vaginal one, it's um, uh, it, there's different types. So when the bladder
Yes.
comes, it's the cystocele, and when the rectum comes, it's rectocele. Yeah. So there's different types, and it could also happen that women can have more than one form of pelvic floor dysfunction. So with
Mhm.
pelvic organ prolapse, yeah. So I think the best thing is if you feel that something is not right, GPs are always there. That's the first point of care. We have the maternal health system in Australia. We're very blessed to have that. And also like getting proper recommendation from care providers and telling them your symptoms carefully so they can, recommend the right treatment plan. Don't
Yes.
shy away from saying that something is wrong. If it's nothing, it's great. But it, it's just like suffering in silence is no good, you know.
Mm,
Yeah.
exactly. And you know in yourself, in your body, if you don't feel right, and if
Yeah,
you're not getting answers from someone, go to someone else. Like if you could go and see a pelvic health physio who
yeah,
specialize in pelvic floor dysfunction. And again, everyone is different. So if you're not happy
that's
with
right.
that information, then go and seek other advice until you are happy
That's
um,
right.
that people are listening to you.
Yes. So I think one of the key problems is a lot of mothers new with a newborn. They really don't find time. They feel like something is wrong, but you know, um, there's no time. So often it kind of gets pushed, and then it gets worse, and it's
Yes,
it's a common story with all of us with children. But I think now there is the advantage of telehealth, and I think for your better life or your child's better life, um, your health is very important. We cannot pour from a empty glass as well. So uh,
yes,
make that phone call if you feel it's, or tell someone like a family member who can help you with making that phone call and turn up to that appointment as well.
definitely. And know that you're not alone in this, that
Yeah.
it's a common thing. So just speak up. From my own experience, symptoms of a prolapse, it tends to be more prominent, sort of a feeling of like a tampon slipping out.
Mhm.
And it's more common if I'm really tired, or if it's at the end of the day, or if I'm on my period as well. That seems to be more noticeable. But then other times I don't have any symptoms.
Mm. Yeah, and it could be really different for everyone. So sometimes what happens is women get quite a bit of birth injury, and this could mean tearing of the muscle from the bone, the levator avulsion, and
Yes, which is mine as
that is the
well.
most drastic form of injury. And look, I think in that case, a lot of women tend to hold it up, and there's like pain eventually that goes through their body. But we do work very closely with the Australasian Birth Trauma Association. So they are a support group based in Queensland, but have uh, like a great they're amazing. I work very closely with Amy Dawes, who's the CEO of APTA, and they have wonderful resources and they do research, and we really want women to help us and participate with us in any form that they can to, really move this field forward. We all want to know how much this affects them, in what ways it affects them, what therapeutics, if we are developing new therapeutics, are they keen to take that up? Is there a concern? So there's a lot of different ways we all can come together as a community, but also contribute to each other's, well-being, and also contribute to the science that is happening. There's a big push from the government for us to involve and get together with the community in our research design to make sure that we're doing the things that uh, make sense and would make an impact.
That's really good news, and I love hearing that we're not kind of being forgotten. It's more that there's stuff being put into this.
Yeah,
Things are moving. Um, I will put in the show notes actually for listeners the Australian birth trauma information, for people
yeah,
to have access to that. So I'm glad you shared that.
yeah.
It's really important. And just going back a little bit about prolapse, just for listeners who aren't sure even what that is. Could you explain what a prolapse is for us?
Yeah. Prolapse is a highly debilitating condition. What happens is there's a downward descent of pelvic organs, such as your uterus, bladder, or rectum, into the wall of the vagina, or sometimes in and out of the body, even if it gets severe. So it's the downward descent. The reason it sort of happens is during vaginal birth, or due to other reasons, the biomechanics of the pelvic floor muscle is compromised. And sometimes when it's generally the pelvic floor muscle is highly adaptable to it's the life condition like pregnancy and birth. It's amazing because it's a skeletal muscle, but no, the skeletal muscle from the leg cannot go through that kind of stretch. The pelvic floor muscle can. But sometimes that equilibrium is lost during the overstretching due to various reasons. The baby's head is big, labor didn't go well, forceps was used. So as the biomechanical integrity is compromised to a certain extent, that ultimately results in the organs not being able to stay up, and they start their descent slowly. So prolapse can start as a stage 0, and then slowly it can start getting worse. So generally what specialists do is do a pop quantification, which kind of measures how your prolapse is graded. So there are ways to help not cure it, but manage the symptoms, such as physiotherapy or use of pessaries. And then until you're eligible for a surgery, then there's surgical options there.
Mm. Yes. And I love that you said that we can talk a little bit about the sort of
Yeah,
non-surgical ways of how
yeah,
to improve products, because sometimes pessaries can be a game changer for people. And I've actually done a podcast episode around one client whose her life has changed since having a pessary, and I'll share the link in the show notes for people who do want to listen to that and who don't know what a pessary actually is. But I would love to talk about your research, because this blew my mind when we spoke, how you are, it's so forward thinking, and the fact that you're, how you explained it was, we will, I know you'll talk about it a little bit, but the candy floss and the
yeah,
threading, but the 3D printing of,
yeah,
like, 3D printing is amazing, like how you can create something in someone's body to help support their pelvic floor
yeah.
is mind blowing. And I'd love you to share this information so that women have this hope. Um,
Yeah, so look, I think I'll start with the conservative ways of treatment where pessary is used. So when the other organ is sort of dropping onto the vaginal wall, you kind
mhm,
of put a pessary in the vagina to push it to a certain way, and that relieves some of the symptoms. And generally, with earlier stage in prolapse, these work really well. So there's pessary clinics, and until they can't they help you manage the symptom, but for some women ultimately it cannot stop the it can delay the disease progression but cannot like eliminate
mm,
further. For a lot of women they still need surgical solutions.
I
So
think,
yeah, and we
yeah.
know about the meshes, transvaginal meshes that were used, and for some women it went really horribly wrong, and ultimately what was seen that the risk of that using the mesh outweighed its benefit. And one of the reasons for that was because the material with which it was made was not very tissue friendly. So when we so it's like, how we have some dresses that we really like, they sit really nice. That's our favorite thing. And there are some clothes we've bought it, but we never touch it because
Mm.
it just doesn't feel right when you wear it. It's just like very uncomfortable. So all these meshes, they're actually a form of textile as well. So they are made up of polymers, and they could be tuned and designed in a way to work well with the tissue. So what we really want is to have more tissue-friendly fibers and tissue-friendly material that could be used in surgery. So one of the advantages, so when we use certain techniques like electrospinning, which is a very common nanotechnology method being applied to multiple areas. But we haven't really explored, we hadn't done much in women's health. So that is where the candy floss thing comes. So it is what the technique involves is like candy floss, you have a solution like the syrup that you have, sugar syrup, and then you spin it, and then you have these really thin fibers that makes your candy floss, right? So we do that similarly with our polymer. It's in a form of a solution, and we apply electric potential. So it weaves into very, very thin fibers. And the advantage there is it's got a lot of surface area. The surface area is very high. So you have these multiple threads of very, very small diameter. They are able to directly interact with the tissue, okay? And that helps them bind to the tissue really strong. And in this way, what we can do is we can avoid any risks of erosion. So once the mesh is bound really well with the tissue, the risk of exposure or coming out, the erosion that were the main issues of the mesh surgery, that could be avoided. So we want to improve this interaction between the cells of the body and the material we put in, and the immune system we want to tell the immune system, look, we're doing something nice here. We're not trying to trouble you. We're not a threat. So we get the immune system to help us heal the tissue rather than saying, you guys are terrible. This is not going well. I'm going to get inflamed and no, I'm going to get angry.
Foreign
Not
object in that body,
correct.
not,
Yeah.
yeah.
So we want to tune the immune response and everything in a more regenerative and reparative direction. And we can actually do that by applying principles of engineering. And that's what we are trying to do. The next step is the 3D printing, which was very exciting because it's everywhere. It's everywhere.
My
But it's
husband's
not
just
in
bought a gift for himself as a 3D
right.
printer for
I
Christmas.
bought a 3D printing pen for my daughter. It's everywhere. Why is it in women's health? Why?
Yeah.
Yeah. Why aren't we using that for improving our health? And so that was our motivation that it's actually a technique of making something, right? It's and then you can do fine tuning of the technique to build various things. And I don't want a dinosaur 3D printed. I want something else. And for me, that was the motivation. So what we are doing is we're working on developing these meshes which have ultrafine fibers, but we are able to automate it using 3D printing. So we recently showed in one of our studies that if you just change the geometry of your mesh, it changes your immune response completely.
Wow.
Okay. Yeah, just simple thing like if you just make your fibers either 90-degree to each other or you just have the angles differently, the body perceives it very differently. So the immune response changes, and so we want to use the future that I envision is that we have a 3D printer and we would have a scan from a women's pelvis, and that would be able to, we can fit that in a structure, an engineering CAD structure will be designed that create the mesh in this way, which can really support the organs for that particular woman in a certain shape works for her. So, and the machine will be able to print it based on how we say in certain ways. Yeah.
So it's like, so we're using the cotton candy analogy, and we're actually then going to print what basically is a pelvic floor for, is it to live inside the
Yeah,
woman's body, acting as like a living pessary?
so it is the body has enormous regenerative potential. You know, we're able to make a fetus, a child inside our body. Our uterus have the power to shed and regenerate to perfection each time for like so many years. Body has enormous regenerative capacity. We just need to give a little bit of a boost. So it doesn't need much. I When we print this sort of 3D printed mesh and we transplant it, what we're doing is we're providing a platform for the cells to come together, and there is the scaffolding. So the mesh actually acts as a scaffold, how we just scaffold everything during our construction. And then once the construction is done, scaffolding can go. So this is, our materials are made up of degradable materials, so they stay in for a while. They boost the regeneration and they will dissolve, just like the
Oh,
stitches they dissolve, you know.
okay. So it's something, would you have to do um, pelvic floor work like Kegels in order to keep supporting it so that when it degrades, then you've got a stronger
Well,
ling or
we have not specifically done experiments till to that end at the moment, but the idea is that once the tissues within the body have regenerated with the help of this scaffold, then it will be able to regain its lost strength again, because the new
amazing.
cells grow and they produce collagen, and that will give the strength to the tissue. So we want to give help to the body to regenerate and rebuild itself. It needs a little bit more from the external, because
Yeah.
generally the body has good regenerative capacity anyway.
This is
So what,
amazing because it
yeah,
means that there's not actually anything foreign in your body forever. It just doing
correct.
the job and then it
Yeah.
will degrade and leave your body with this
Yeah.
beautiful new
Yeah.
pelvic floor.
That's right. And this is being applied to other areas. Like we have, my sister recently had a shoulder surgery and she had a graft in her shoulder that just dissolved over time and
Wow.
just fine now. So for bone breakage and other areas, it's done. So the reason, I mean, I think the idea to use mesh for prolapse has been there and was being used. I think what we didn't have was that understanding that how these meshes need to be or how they would react differently in a vaginal environment compared to another tissue, like facial creams. They work fine on the face, but we wouldn't use it in, tender areas. They can be
Yeah.
different. So I think each tissue and the reaction in each part of the body can be different, and that needs to be investigated. Okay, there, and we need to fine tune and understand what these interactions are and use it to our advantage to regenerate. If we don't understand, we will not be able to do the right thing. So we need to understand how materials and cells are interacting in the vaginal environment. What are the key things that are important for the healing and regeneration? And apply those. We want to be able to do the right thing for the vaginal regeneration, vaginal surgery, and not just think, oh, because it's working in another part of the body, it should be fine, right?
Yeah,
That's what we
exactly.
want to, yeah, we want to
Have
avoid.
have you done, has this been used on any woman's prolapse yet?
No, no. So so these are now classified as class 3 devices. So there's a long pathway um, to ensure that we do not repeat our mistakes from the past of using something that could cause more problems. So we are currently in a stage we're doing lab work and preclinical testing to develop the product well enough for going into clinical trials. So that again, it's a very unique area of work. So you need to train people, the workforce, and raise the funding. So
Mm.
it's and then do the science as well. So it's on the way. I would say that we've made a great start, although there's still a long way to go. But I'm hoping that in future we will be able to make a difference. No successful therapy was actually made overnight.
Yeah,
Anything,
yes.
even any painkiller medicine that we just pop in when we have a headache, if you see the history of them, they have taken many, many, many years to actually come to the point of safety that I feel, oh, it's just like been a hard day,
Yeah, yeah.
uh,
Just pop a
headache,
pill.
and I just really need a panel. It's taken a while to get to that level. So
It could be the new normal, couldn't it, in the future to be like, oh, I've got a
yeah,
prolapse. Let's just go in for my cotton candy
yeah.
and we're all good.
Yeah, and I feel that is not too much to ask for, isn't it? Like if I am unwell, I just go and get a treatment. Is that too much to ask for?
Exactly, especially for women. Like we
Right.
are growing humans inside our body.
That's right.
We should be allowed not to feel traumatized or left with physical, emotional trauma
Yep.
from just doing that.
Yeah. And like so the other thing, so these meshes, like irrespective of the 3D printed meshes, they are still foreign, right? So they're still going to um, kind of trigger some sort of response when they are going to be put in the body because they are not inert. If they are inert, they can't heal really well. So it's kind of a double-edged sword there. But what we can do and what we are trying to do is boost them with stem cells from women's own uterus. So the uterus has amazing capacity to regenerate itself every month, and there are stem cells that have the regenerative capacity. So we are trying to see whether these cells can be bioprinted on the meshes that we make. So if we go to the future that I envision is like we have a mesh that we have created based on the MRI scan or whatever from the women, and this polymer has been printed, and the women's cell is loaded into a cartridge, and we can print that on the mesh, and that whole construct is then surgically implanted. And you know what? This is not it's not that it's not being done. Like if you look at IVF, this is what is being done. You take something out of the body, you process it, and you put it back in the body, and miracle, right?
Yeah.
So it's not, it has been there in some forms in other areas. They are using it for the immunotherapy for cancer as well, where they take cells out, treat them, train them, and put them back. So I think similar, we want to have high tech treatment for women, not just relying on, oh, just let me just put a stitch in,
Mm.
hope for the best.
Yeah.
Hope is not a strategy. So we want to go high tech, bring our best technical advances and improve pelvic floor health. That's my vision, and my mission is to really drive that, create the workforce, and make sure that we're getting somewhere, if not, maybe not immediately, but definitely.
Yeah. And I just want to thank you for being that way and actually giving mums support, because there is a lot of lacking when it comes to postpartum care and support for mums. So this is an exciting new uh, way of things coming.
Yeah.
Um, just going back a step, how does this compare to the current surgery that's being offered for prolapses?
Yeah, so I think the transvaginal surgery is not allowed in Australia at the moment. So
Right.
uh, the surgery, it's very hospital based as well. What sort of grafts? So there are some biological grafts being used. So a tissue could be harvested from the thigh, and that is used to surgically implants. It's going from the abdomen rather than the transvaginal to lift the organs. There's some meshes still being used in the for from the sacropexy surgery. So it's very hospital based. There are some pockets here, but each have their own pros and cons. So I think we don't have like a generally, I think the consensus on what is the best is still kind of being developed, and all the clinicians and scientists, they're coming together now and interacting more with each other, interacting with the government as well, and trying to bring out the best for patients. So there is definitely a very nice movement going on where it's not like a scientist is a scientist and a doctor is a doctor and they don't talk to each other. We're trying to come together. We're trying to build societies where we learn about each other's work more. So together we can create the best solution possible.
Wow. Brilliant. Shayanti, that's been amazing to interview you on this. I'd love to pick your brains even more, but running out of time. Is there anything that you want listeners to know or to leave with?
Look, I think I'll tell you my background is actually in engineering. I've studied biotechnology where I could choose between making materials or in food science. And then so the background can be varied. And then I did work in cancer hospital as well to train and understand how the immune system works. Eventually, I saw an image on the internet where one of the professors he was making, and it was a very high zoomed in version of how that cotton candy, that mesh was. And I, like you, I was like fascinated by this. Like, I want to be able to make that. So that I went into a more deeper engineering training. And then ultimately I landed in women's health. I had no connection with obstetrics, gynecology, nothing. So what I would like to tell everyone is no matter what your background is, you can always contribute. There are many ways to contribute. There are some people are good at advocacy, some people are good at writing, some people are good at science in one field. there is just no one particular way of looking at solving. If you really want to contribute to making a difference, there is always a way. We're always there to reach out, and there's enormous support. All you need to do is reach out, you know. So I would say, don't think you're alone. We're all there for each other, and if you want to contribute in one way or the other, there's always a way to be a part of this movement where we want, all we're demanding is good health for mothers after they've given birth. And, so yeah,
Yes.
never alone.
Yeah, lovely. Oh, thank you so much, Auntie. That's been a pleasure speaking to you, and I hope you've enjoyed your first podcast.
Oh, I've loved it. I could go on and on, right?
Good. You'll have to do more then. You're in the flow.
Uh, thank you, Lara. Thank you so much
You-
for inviting me and giving me this opportunity to talk from my heart. Um, and connecting. It's we often do science and it's very hardcore scientific language, and
Yeah,
so this is really enjoyable. I do love interacting with the community, with people, friends, and want to let them know what we're doing, learn from them what's happening. So yeah, I love this. Thank you.
good. I'm glad. Bye for now, everybody.